Welcome to today's episode of Loving Yourself. How to love yourself first before being able to love other people or pour into other people's cups, like your family and your friends. Because if you don't love yourself, like the airline announcement says, how are you going to provide oxygen and love to those around you? Today we talk about our skin and not just about our aesthetics and confidence. Of course, that's a big part, to look your best in order to lead the best life, to love yourself, but also about some of the dangers of pigmentation. Because today we're talking about pigmentation, and I have my very own dermatologist here, Dr. Eric. Hello.
Thank you, Serena C. So
yes,
yeah, I'm a board certified aesthetic physician from Malaysia, and I've been practicing aesthetic medicine for the past 15 years. So currently, we have 3 outlets throughout Malaysia. The headquarters being Berjaya Times Square, followed by another 2 outlets in Johor and Kota Kinabalu.
They've already gone to East Malaysia, so you know how broad the influence is of ME or Me Clinic. I call it Me Clinic because it's ME. And you oftentimes see me update my stories about my treatments at Me Clinic. And that is the most important point, because you cannot go in for a treatment and hope for magic to happen. Whether it be, those non-invasive facelift treatments or all kinds of treatments. But today we're focusing on pigmentation, because I am the success story of Me Clinic here, because they managed to make my pigmentation go away. That's the vanity. But first, let's talk about different types of pigmentation. Dr. Eric, this is you.
Okay, so basically pigmentation is a serious issue, and it causes a lot of psychosocial disturbances. It actually reduces someone's confidence. So there are actually many types of pigmentation. So in my practice, I comes a lot, few types of pigmentation, which is actually quite common: the freckles, melasma. You have liver spots, solar lentigines. So all these actually it's due to sun exposure. So majority of the cause is due to sun exposure, and of course, second factors that play an important role is genetics.
Yes.
So genetics is actually also one of the cause for serious pigmentary disorder,
which is what we call pigmentation, right? So freckles might be cute, but sometimes freckles can be dangerous too. We will get to that part later. How about we talk about the different types of pigmentation that you're I know you presented, or you prepared a lot of pictures for us, isn't it? Tell us about melasma. Is it melasma?
Yes. So melasma is something that it presents with a dark patch of discoloration.
Right.
It actually symmetrical, present at both cheek. And it can be both type. One is a deeper part. We call it the dermal melasma. Another type is is more superficial. We call it the superficial part of melasma.
Present on both cheeks, meaning both sides, left and right.
Yes.
So I don't have melasma.
Yeah, you don't have it.
Okay, mine is something else. All right. So more about melasma.
So melasma, the causes can be usually due to sun exposure,
right,
or any woman that is taking oral contraceptive pills, genetics predisposition. So all this, it will contribute to the formation of melasma.
Contraceptive pills keep popping up on my podcast. It doesn't seem to be very good. Because why do contraceptive pills cause melasma, for example?
Okay, it's because of the ingredient itself. It consists of estrogen and progesterone.
All right.
So these 2 ingredients actually it activates the melanocytes, the pigment producing cells in our skin. Okay. So you will activate it, and it produce all this melanin.
I see. Yeah. So you said melasma is present on both cheeks. Is it normally one dot or many dots?
It's a patch. Usually it looks like a butterfly shape, almost symmetrical. And some of the patient, it will present at the forehead as well. Yeah, one big patch, yeah.
Okay, all right. I will let the pictures tell you the story. So what does melasma look like? Let's show you the picture.
Yeah, so basically, like I said, there are 2 types. One is the epidermal type and dermal type, which is the deeper layer. So this is the example of the photos of melasma. You can see actually it's a patch of pigmentation. Usually it occurs at the cheek area.
Wow, that's a very big patch.
Yeah.
So it's like a lot of freckles.
Yes.
How is it a butterfly shape. Where's the butterfly shape?
Yeah, butterfly shape actually is basically you compare the right and the left cheek. It actually have a same distribution.
symmetrical.
Yeah,
Okay,
symmetrical. Yeah,
Okay.
yeah,
So this is melasma.
yeah.
And this is
how
not
it looks like.
malignant.
Yeah, it's a benign pigmentation. It's not. Yeah.
Okay. All right. So from melasma, we move on to freckles, was it?
Yes. So freckles normally it occurs in a younger age group because during childhood, most of them they like to go under the sun. So it appears at a tiny, small dots all over the face. So it's something that people might think is cute.
I think it's very cute.
Yes.
I think now is a makeup trend to make freckles too, fake freckles.
Yes, yes.
But it's not entirely cute, right?
Exactly.
When does it become dangerous?
So it's not something dangerous, but basically people will come to us when they want having a good cosmetic appearance. It's for cosmetic reasons. They want to get rid of the freckles. They'll come for lasers and certain topicals.
Okay, which we're going to talk about later because that is what I came for as well. I don't have freckles. Why would you want to get rid of them? They're so pretty.
Yeah, you see. So this is an example how the freckles looks like. Yeah.
Yeah. Okay. So freckles can be full face or a bit here.
Yeah. So over the nose. Yeah.
So normally around the nose area and the cheek area, would you say? Okay. All right. So freckles doesn't have to be life-threatening, right? It's just aesthetic. Okay.
Benign. Yeah.
Okay. Next, what do we have?
So the next one will be, this is what we call age spot, or some they call it the liver spot. It's like a small, it's bigger than freckles.
Okay.
Solar lentigens.
Okay.
So it's due to UV exposure as well. So
basically people who don't put sunblock or you're in the sun too much, you get this. And this is not genetic.
Genetics play an important role as well in most of the type of pigmentation, including freckles. Yeah.
Okay, as in you're more likely to get it genetically.
Yeah.
Okay. So lentigy, age spot, and liver. Okay. Well, what does it look like for us?
So this is how it looks like. This is the bigger patch of lentigens.
Wow.
Yeah.
Is that me?
Yours is a smaller one.
I am lentigo.
Yes.
Okay.
It's actually the same thing.
Okay, so I am lentigo, and lentigo can be shallow or deep as well, is it?
Usually it appears at the upper layer of the skin, but it varies in size. It can be big patch like what this lady have, and it can be a smaller patch.
Okay, but it's more on the surface. It's not
most on the surface, exactly.
Then why is mine so stubborn? We'll get to that later. Yes. Okay, so lentigo is what Serena has, so you can have a comparison later. Oh, that's okay. That looks like me.
Yes, exactly.
Just because when I was 20 over years old, I had something like that on my cheek, and no amount my upper here, cheekbones, and no amount of concealer could conceal it. And this is very bad for a young girl's confidence, isn't it?
Yeah.
Okay. What do we have? Okay.
Same thing. I think this is more like your case.
That's basically me.
Yeah.
Yes. That's basically me. Okay.
Yeah. So all this sometimes will give someone's lack of confidence, So the fourth pigmentation is Horis nevus. This one is more on a younger age group. So the color appears slightly different, more of a light brown to bluish discoloration.
Okay.
So this is something that we can handle it with lasers as well.
How does this present itself? 20s onwards and maybe in family history. Okay. And what does Horis nevus look like?
Okay. So this is how it looks like. And you see the color is a bit different. It's not purely brown. You can see some blue, grayish discoloration. Yeah. So
well, to the naked eye, to normal people, this is actually very hard to tell apart.
Exactly.
So that's why you have to see a dermatologist to see the different types of things. Okay.
You need more sessions of treatment to get rid because some of the Horis is quite deep.
Yeah. Horis nevus is deep, but it's not malignant. It's not dangerous.
Yeah.
Okay. Is that the last type of
the
pigmentation that is not malignant? But now we move on to things that might be malignant. All right. So what kind of spots should we be aware of to have a look at? If you start seeing this, then you need to consult. What kind of doctors? A dermatologist as well?
Yes, dermatologist.
Okay.
Usually we start to suspect when a lesion appears to be malignant based on a few factors. When we see that there's a mole that's growing in size.
Right.
And any color changes, instead of a black color, it became red, and pinkish discoloration. So all this will create a suspicion towards a malignancy.
So if it changed, basically if it
In
changed
colors,
color, then you know that you need to consult a dermatologist first, and then eventually to treat skin cancer is also a dermatologist?
Yes.
Oh,
So
wow.
basically they will perform a biopsy to see what kind of skin cancer. Because there are 3 subtypes of skin cancer. Due to prolonged exposure, the most common one is basal cell carcinoma. This accounts for about 80% of 70 to 80% of the cases. The second commonest is squamous cell carcinoma. And the third one, which is very rare, it actually comes from the pigment cells, and we call it the malignant melanoma.
Wow.
So that is actually quite fatal. Actually, people will die from it. Yeah.
If not treated.
If it's not treated and or we detect it late, it
what
will
is
actually
the
spread.
timeline like? How does it surface to begin with? Is it also from inside your body? Is it genetic?
Genetics play an important role as well, but sun exposure, UV rays, because especially UVA, it have a longer wavelength.
Okay.
So what happens? It will go deep to the skin. It will actually cause changes in the cell's DNA. So in our body, it's actually very special. Most of the cells, basically, it have a certain lifespan. Like skin, every 2 to 3 weeks is supposed to die, and the new skin will regenerate. So what happens in cancer cells? These cells will keep on multiplying without putting a pause. So in skin cancer, UV exposure is one of the causative factors,
Yes, of course. That's why now in this day and age, at least, we know to slap on our sunblock on our kids as well, because we know of the dangers of skin cancer. Now that we know that, we know kind of how to look out for spots that might be cancerous, let's bring you back to today's topic, pigmentation. So Serena's journey is, how do you call that name again? Age spot? It's called age spot, or otherwise?
Lentigen.
So, that one. Very hard to pronounce. I actually had a very, I would say I would be one of the success stories of me clinic, because, after 5 sessions of laser, it was completely gone. So I was very happy, because I've tried many clinics actually before this, and we weren't able to figure out what was wrong. Maybe it's a different type of laser, or maybe I had topical, I had injections and all that. So what do you think worked for me?
Okay, so basically for pigmentation, especially your case, we need we have to look at a few angles. We can't depend solely on the lasers treatment. So basically skincare, UV blockers, sun exposure, we have to limit outdoors activities. All this will actually control the pigmentation from becoming darker. So,
but that didn't work with me, because I obviously I go camping, I go swimming, I got seen. But you still managed to make it disappeared. After 5 treatments, my pigmentation basically disappeared. So what do you think it was? It was the type of laser that you used?
Yes, it's because we are using one of the energy-based device called the 𝙂𝙤𝙞𝙨.
Right.
Or we have an in-house term, we call it the 𝙂𝙪𝙚𝙨.
Right.
It basically, this kind of wavelength, it helps to shatter the pigmentation, and these melanocytes will get shattered and it get absorbed from the body. So within, normally the session is within 1 or 2 months apart, it will slowly get rid of the pigmentation.
So if you look at my timeline, you will see how it shattered basically what used to look very dark.
Exactly.
Like a map to now pretty much, it looks like freckles. I look cute.
Yes.
But one thing to note is that it did come back. Because like you said, like I believe it was my lifestyle, I forgot to put on sunblock or whatever, it did come back. So would you say consistency is key? How often do people have to go for their laser treatments?
Yeah, so basically once you get rid of the pigmentation, it's best to visit your physician for 2 months or 3 months once laser maintenance. So all this maintenance, it will suppress the melanocyte, and the chances of this pigment to rebound is actually lesser.
Okay.
Yeah.
It's lesser, but not impossible. So we're not
Exactly.
saying that, you all are miracle workers, but this is a long-term thing, isn't it?
Yes,
It's
yes.
maintenance.
We need discipline, maintenance, persistence.
Yes, that's why me clinic calls me all the time to come in for maintenance. But maintenance is not just laser as well. We brought one of the star products today. Your physician probably has their own, but this is what I use for from me clinic, and I have to say it helped minimize a lot.
Yeah.
Because the laser itself, yes, it helped, but after using this, now it's hardly noticeable. Last time, if I put concealer, you can see everything. Right now, you cannot see anything. So what is in this thing, and is it safe?
Okay, so basically after the pigmentation became like we need something to suppress the pigment producing cells, which is actually the melanocyte. So this is, we call it a tranexamic acid, whereby it acts to deactivate, basically to reduce the formation of the pigment. So not everyone will want to go for lasers for lifelong. So we need something to suppress the pigmentation. So this is one of the cream, tranexamic acid. It's very gentle, and you can use it
Daily.
daily and lifelong.
Daily, lifelong. No side effects. Right?
No side effects, yes.
Even if I don't come from my treatment, because eventually I get lazy, if I get this, I will be able to kind of control it.
Exactly.
Yes.
Yeah.
And on top of that, of course, the most important thing, to prevent to begin with, is sunblock.
Yes.
Yes, Me Clinic actually have their in-house brand called Oceanic Protector, which I use as well. So tell us how important sunblock is, doctor.
Yeah, sunblock, usually we will advise our clients to go for broad spectrum.
Mm-hmm.
So like our sunblock, it consists of physical blockers and as well as chemical blockers. It blocks both UVA and UVB. So
What's physical and what is chemical?
All right. So basically physical is something that when you apply, it sits on top of the skin.
Yes.
It reflects the UV rays.
Okay.
Chemical is something that it absorbs, but it will dissipate the heat to the environment. So it have two kind of mechanism of action. Yeah. So basically it gives you the maximum protection.
Mm-hmm.
So sunblock is very crucial, especially for everyone and for those who already undergo a lot of sessions of lasers. So it's very important. Yeah.
Okay, so you got the laser, and then you couple with a treatment daily, and then this is definite the first thing. The sunblock is the first thing. Now, how often should we reapply sunblock if I am an outdoor person?
Yeah, outdoor, usually our advice our customers to apply every 2 hours. But if let's say you sweat a lot, or you have your clothes rubbing on the sunblocks and tan, especially after swimming, you have to reapply immediately.
That's what people forget, isn't it?
Yeah, exactly.
Forget to reapply. So every 2 hours, you say?
2 hours, yeah.
But a lot of people also forget that sunblock applies to inside. Why?
Yes. So sunblock, some of them, they have a lot of myth that we have to debunk. Indoor, we don't have to use sunblock. But actually, from all the gadgets nowadays, television, LED lights, handphone especially, we have a light called the blue lights. So what happened, this kind of blue lights, it would trigger melanin formation. It will cause pigmentation. Yeah.
Okay.
So it's quite crucial to apply sunblock.
And how often do you have to reapply that one?
2 to 4 hours.
Same lah. So basically, a rule of thumb is 2 hours.
Yes.
So around here. So if you really want, pigment-free skin, you have to
apply.
Rajin lah. Sunblock number 1. This is together with the treatment, or without if you're lazy for the treatment. Now, oral ones, do they work? Is this considered a oral sunblock of a kind?
So basically, it's not something new.
Mm-hmm.
There are plenty of brands in the market. Some of them, I think, this oral sunblock. Once I take it orally, I don't have to apply. But this kind of oral sunblock is basically a supplement towards, besides we use the topical sunblock. Mm-hmm. It gives you, it's not a primarily solution for pigmentation. It's something that we can add on top of a sunblock. Yeah.
Okay, so you have to take your sunblock on top of that. I mean, the actual sunblock, oral is just an add-on, right? A lot of people are selling I'm not naming brands, but there are a lot of brands in the market that say, oral sunblock releases a glow from within. What is your thought on that? Does this?
Yeah, basically oral sunblock, they have other additional ingredients like the tomato, they have plants like fern, and they have all kinds of active ingredients whereby it will give you a lot of anti-inflammatory effects, antioxidant. Of course, indirectly, it will give you a more brightening complexion. Yes. So all these, they have a supporting data. And of course, together with the sunblock, it gives you a better results. It will suppress the pigmentation.
So what do we watch out for? Because there are hundreds of products in the market, right? Like what kind of certification are we looking for? What kind of label do you look for something that is credible?
Yes. So to me, the ingredient itself is very important. Just like this is what we call the Nano MD. So this Nano MD, they have few active ingredients. Is proven in the studies that it helps to improve pigmentation, improve the skin brightening effect. So these are what we call the fern plant, and they have this tomato extract.
Okay.
And they have all amino acids like L-cysteine. All this, it will give you a good results.
Okay, so you look out for ingredients.
Ingredients,
like that.
yes.
Okay. So what are some of the hype products out there that you don't think is very credible? What kind of ingredients should I look out for that is not good?
Basically, the top ingredients that have scientific proof that it works are those that I mentioned. So the other kind of ingredients that not heard before, but basically we have to be very cautious.
Yes.
Yeah. So go for the active ingredients that actually proven to give you a good result.
All right. So let's repeat those ingredients again so we know.
Yeah. So they have the pine bark and tomato extract.
Tomato extract, pine bark. Okay.
Yes. And fern, F-E-R-N, fern.
Okay.
L-cysteine.
L-cysteine.
Yeah. So those are the 4 active ingredients.
Okay, look for these 4 active ingredients because you're going to be bombarded with all kinds of products, right? So these should take care of pigmentation issues. Well, that pretty much covers our pigmentation part of today's talk when it comes to confidence. So would you say all types of pigmentation that you mentioned today need at least, because for me it was 5 sessions to completely dissipate? At least 5, 6 for you to see results?
Exactly. Some might need a little bit more, especially melasma. Because melasma, it can be superficial, it can be deep. So it's a very challenging skin condition that most of the patients couldn't get rid of it. So melasma, even with more than 10 sessions of lasers, you might be still able to see some remnants of the pigmentation left behind. So we won't overpromise our patient. We just tell them we give you at least 50, 70% reduction.
Yep.
And what we expect from them is a realistic expectation. Yeah.
Yes, so you need to be realistic about this, okay? Because they're not magic makers. Although they did make mine disappear for a while. It came back. We're going to keep trying. And also, different types of lasers work on different people, right? Some, they may go for because in mass market, there are all kinds of lasers.
Exactly.
Oh, that's also another question. How do you identify the ones that are, because there are a lot of very cheap treatments out there. How do you identify the scams?
Okay, so basically, good lasers, you have to slightly pay more. And I wouldn't judge that cheap laser is not good, but go for a certified physician for your skin.
Okay.
So in the clinics, normally they will use FDA approved lasers. They're actually safe, proven safety, and the physician will tell you which kind of lasers and for your kind of skin condition. Yeah.
Okay, so FDA approved. So how many lasers are we talking about that is different for pigmentation?
Okay, for pigmentation, the current trend that most of us are using is 𝙂𝙪𝙚𝙨 lasers.
Okay.
You have pico lasers, and some of them, especially for melasma, they use microneedling radio frequency like Silphem X. So all these somehow will give you a pigmentation reduction.
So all these are approved.
Approved,
right?
yes.
Okay. So let's go through the list again. For pigmentation, we have pico and
Q-switch laser.
Q-switch is mine, okay.
Yeah, then you have microneedling, radio frequency.
Radio frequency. So when you hear these things, that means you're safe, right?
Yes.
Anything else, please check again.
Yeah.
And they need to be FDA approved. So that takes care of the confidence part of it. I hope you know if you have any pigmentation issues, you talk to your proper dermatologist
Exactly.
physician
Yeah.
and get your skin assessed. And obviously, if something is growing or, changing in color, then definitely talk to your dermatologist. That's for today's Loving Yourself. Before we end this episode, is there anything else you'd like to add, Doctor?
So basically, in order to stay young, keep yourself young, have a good skin complexion, we have to follow a proper skincare regime. Start from cleansing, toner, moisturizer, and make sure you apply your sunblock every day. Yeah.
That's a very crucial part. And the moisture part, because
Yes.
sometimes, like you said, laser dries up my skin.
Exactly.
So therefore, don't forget your moisturizing and your facial if you have your time, right?
Exactly.
Okay, and with that, we hope you increase your confidence when it comes to pigmentation and tackling different types of pigmentation and where to go to consult. You can also check out my doctor. Dr. Eric is available at Me Clinic. I go to the main branch at Berjaya Times Square. If not, ask your own physician. We hope we helped yourself to love yourself a little bit better today.
Thank you.